today's session. We're going to be recording starting now. And so the posting for the recording as well as our materials for today will be at mnabe.org under State ABE Presentations. So welcome. Today is Thursday, June 25th. And today presenting, we have our adult education staff at the Minnesota Department of Education. My name is Brad Haskamp. I'm the Adult Secondary Credential and Education Policy Specialist. Joining me is Todd Wagner, our State ABE Director, Astrid Leiden, our PD Specialist, Jody Versa, our Program Quality Specialist, and Julie Dinkow, our Transition Specialist. We're also very grateful to have Carla Vian from Literacy Action Network hosting today's event and providing technical assistance and technical help for our participants today. Thank you so much, Carla. For everyone, how you can participate. Many of you are using the webinar's chat function, and we encourage you to continue using the chat function to tell us how your summer programming is going so far. When we get to Q&A sections, we will encourage you to raise your hand to ask your questions over the phone or over your headset during those Q&A periods, and we'll unmute you too. Please note today we have a lot of topics for discussion and a lot of slides, so we will be kind of limiting some questions for the Q&A periods. And also, if you have any tech issues, ask Carla Vian or reach out to Carla Vian and she will be able to help you. Today, our 8 topics include some announcements and reminders, discussion about fall ABE programming guidance, testing, high school equivalency and GED, transitions, distance learning, professional development, and we'll have time for your questions as well. Not just at the end of the session, but throughout the day. And we do also have quite a few materials in the materials tab, so I encourage you to download those as well. The resources from this webinar, if you don't download them will be available online at mnabe.org under State ABE Presentations, along with the recording. So let's kick off with some announcements and reminders. We have been doing our check-in discussion about summer programming. Astrid, do you want to come on and highlight some key points from the summer programming discussion so far?
Sure. The responses are coming in fast and furious. Thanks everyone for chiming in to share how things are going for you this summer. It seems like overall many programs have continued with strictly distance learning, and some are starting to do some hybrid programming. It looks like for the most part, those who are doing hybrid programming are seeing pretty low numbers with the in-person portion of their programming. And just overall lower numbers in even the distance education portion. And I'm thinking it might be valuable, Brad, if we post the chat responses along with our recording of this webinar so people can get a sense of what others in the state are doing and follow up with them as it might be useful to them. Also getting some responses in about GED testing, and we do have a poll later on in the webinar to check in with you on how GED testing is going in your area.
Excellent. Yeah, it's a rich discussion. I agree. Posting the individual comments or chat log will be great after this session. Please continue to chat in your check-in on how summer programming is going so far if you've started. Thank you, Astrid, for summarizing that. So at this point, I'm going to turn it over to Todd Wagner, our State ABE Director, for our motivational slide. Todd, it looks like you're self-muted.
Oh, thanks, Brett. Hey, everybody. Thank you so much for joining us for the update webinar today. We've got, as Brad has outlined, a very full slate of stuff to share with you. I just have a couple initial kickoff slides here. And this first one, like I think we've done with every update since the COVID pandemic became a disruption for our programming. Just want to once again acknowledge really how amazing it's been to see the way that the ABE community has come together to support each other, to share resources, and really just the tremendous leadership that everyone has provided in ensuring that our system continues to function and serve the folks of Minnesota. So please know that for all of us at the MDE ABE office, that we are really proud to be part of Minnesota's ABE system and be working alongside all of you. So thank you. Next slide, Brad. The other thing that I'd like to share with everybody is just a quick update on the contact hour reporting period working group. And so just to remind everybody, I guess, we have convened a group of 9 folks from the ABE community who we selected based on having that group of 9 people be as broadly representative of all the various stakeholders, regions of the state, roles that different folks play working within the system, etc. So that group of 9 people has met for the first time on June 8th. And we'll be meeting again early in July. And what they are charged with is making a recommendation both to Literacy Action Network, the Literacy Action Network Board, and also to the Minnesota Department of Education ABE staff regarding what time frame to use for the contact hour report, basically the table A or A1, that will be used in the ABE formula for fiscal year 22, which is the 1921 or the 2021-22 fiscal year. And we've asked them to, the focus is on time frame because that is the factor that that the state statute empowers the Department of Education to make a decision about. And we are asking them, that group, then to focus on making a recommendation that will minimize any negative financial impact on ABE programs across the state. So we don't have a decision yet regarding which hours, what time frame will be used for the contact hours to use in the formula for fiscal 22. But we will have a recommendation from the committee, I'm sure, by the end of this summer, and we'll be making a decision about that. So in the meantime, our message is really still the same message that we've had throughout the COVID disruption, which is please focus on serving the folks that you serve as best you can, using whatever resources are most effective to reaching a given student or a given student population or delivering a certain content area without regard to without considering whether or not the hours from that programming are countable under our current policies. So again, the goal is really provide the best service you can with whatever resources you have and that work best. Do not worry about contact hours and trust the process associated with the contact hour reporting period working group that they will arrive at a recommendation that will best minimize any negative financial impact on ABE programs across the state. And again, this is my last slide, so thank you everybody again for joining us.
Thank you, Todd. Todd, as we go forward, Jill has asked who the members of the working group are. Do you want to share a little bit who the members are? I know that the group is being led by Todd Wagner, our state ABE director at Minnesota Department of Education, and Susan Wettenkamp Brandt, the president of Literacy Action Network. There are 9 members of the group. I'll kick it off and then hopefully someone from our team can kind of finish it out. We have Anthony Williams in Minneapolis. We have Eric Nessheim from Literacy Minnesota. We have Tracy Chase from AEOA. We have Kirsten Fugelseth from Northwest Service Co-op. We have, oh dear Lord, I'm gonna already fall apart here.
Deb McDermott Johnson from Southeast Minnesota.
Yep.
We also have Amber Delager from Metro North ABE.
Yep, and Heather.
Eric Lynn from Rave.
Yep, and Heather.
Heather
from Robbinsdale.
Yep.
We get everybody, or are we missing one
Has
person?
the list.
Yeah.
I think you got everybody.
Oh, wow.
Yay. Thank you, everyone.
So as you can see, that group is very representative of the whole state, all regions of the state, different kinds of programs, different roles, ABE managers, teachers, community ed directors, supports, service professionals, a very diverse group.
Yep. And we want to thank everybody else that, oh, thank you, Margot. We forgot you. I apologize. Yes, Margot Rainwater from DOC. We apologize for that. Yes, we definitely wanted to make sure we had DOC representation in this working group as well. And thanks to everyone else that applied for the working group. It was some very tough decisions to narrow this down to a group of 9. Ideally, we could have accepted everybody, but unfortunately, we needed to kind of pick a group of 9 that could best represent the entire state. So thank you all. Okay, at this point, I'm going to turn it over to Jody.
All right, good morning. Oh, can you hear me?
We lost your audio for a moment, Jody. Can you try again?
Oh, can you hear me now?
Yes.
Okay. Morning, everyone. I wanted to make sure that everybody is clear that when we're talking about that contact hour working group, we are really talking about the funding calculation that will happen a year from now. So the funding calculation for fiscal year 22. Meanwhile, currently, we are working on the aid calculation for this upcoming fiscal year, the one that starts in a few days on July 1st of 2020. So you all submitted your annual applications with your hours and your tables in June, and we are working hard on our end to get all of that pulled together and get that aid calculation completed. We had a little bit of a snafu in terms of the software that we use to do that on our end here at the Department of Ed, but we think that's been resolved, and we are moving forward with that work as quickly as we can. So just a reminder of the process is that what we do is we calculate a preliminary aid distribution to all of the consortia. And the first thing we do is post that to the MDE website. And when that happens, you will receive an email from our office, and then you'll need to make sure at least, one person from each consortium or each grantee goes out and takes a good look at those numbers and check to make sure that everything looks the way you expect it to look. If there are any issues or you have any questions, please do reach out to us right away to talk about that. And often many years there is some glitch, some mistake either on our end or your end, and that preliminary calculation is the window to address those issues and get those fixed. So be watching for that email and be ready to go out and check and make sure your numbers look good. Just at this point, what we can tell you about hours is we can tell you what the statewide total looks like for last year's hours. If we look at the total for our traditional hour counting period, so May 1st to April 30th, as expected, those hours were down as compared to last year. So those hours were a little over 4 million. But remember, we did adjust the time period for contact hours that we're using in the formula. So the hours in that adjusted time period, so that was the table A1 hours from March 2019 to March 2020, were about 4,472,000 statewide, which when you compare that to the previous year, we're pretty even, a little bit up from 2018-2019, which was 4,466,000. So for those of you who kind of, like to have a sense of where we sit, those are some preliminary numbers in terms of the statewide hours total. And just a reminder that for fiscal year 21, we did get a 3% bump in our state ABE funding. So the total pot of funding that we have to distribute statewide is a little bit bigger for this year. So that, of course, is good news. But be waiting for that preliminary calc to be posted in order to see the details of what exactly that's going to mean for your funding for the upcoming fiscal year. Next slide, Brad. We did want to mention briefly about CARES Act funding. So you've probably been hearing about the CARES Act and the related funding. So this is federal legislation that that appropriates quite a lot of money nationwide to address coronavirus COVID-19 response. And some of that funding is intended to support education systems. The federal government distributes that funding to states, and then at the state level, the state government has the responsibility to figure out how to distribute it across the state. So in Minnesota, the distribution of that CARES Act funding that's specifically for education, that is being led at the Minnesota Department of Education, and our ABE team is not directly involved with that work, but we have gotten some basic information about it, and really our takeaway is that it's very focused on our K-12 schools. So they have identified the eligible applicants for that funding as districts and charters. So, I think many of us from an ABE perspective say, wait, we're not all districts or charters, and that's true for ABE providers, but the sort of the framework in place for distributing this funding is very much focused on our K-12 schools. So the very short version of how that funding is being distributed is that districts and charters are receiving like the biggest portion of that funding based on their the amount of Title I students that they're serving. So based on serving students in poverty. There's a couple other smaller pots of funding that have sort of more specific purposes and have a little bit of a different approach to distributing those funds. And if you want to kind of dive into those details, you can follow the link on the screen here. But basically, we believe that in terms of ABE, it won't be possible for ABE providers or ABE programs to apply for these funds independently. However, we do think that in some cases there could be an important collaboration between ABE and the larger district, or at least ABE could have a spot at the table for some of those discussions, or an opportunity to access some of the benefits of those funds. So we're curious if any of you, particularly those of you who work, in your district, in a district-run ABE program, have you had any conversations with district staff, district leadership about the CARES Act funding? anybody kind of have any leads or thoughts or ideas about how ABE could benefit from any of that, or is it a little soon, maybe? Not seeing anybody jumping in right away, so I wonder if that means maybe you haven't had a chance to consider that conversation yet, or maybe even at the district level, those conversations haven't happened in earnest yet. Okay. Yep. So yeah, sounds like a few people, yeah, maybe you just haven't gone there yet. So consider it kind of a heads up, something for you to think about. I think it is true that if your district serves a significant Title I population, that your district leadership will be talking about this. So something to think about. I think, one small idea I think that we had is maybe to consider if your district is going to use some of these funds to make sure that kids have devices at home. You could be thinking about, how often is it true that a K-12 student at home has an ABE student as their parent in the same household, and that might be a way to sort of connect some of those efforts. Right, so I see your comment, Tom, about CARES funding going to workforce. Yes, not all of the CARES funding is specifically for education. There are other pieces or other parts of the CARES funding. So what we're talking about here is specifically the portion of it that's designated for education, but right, you also might want to think about and investigate some of the other sort of streams of that funding, including what's going through workforce, the workforce system. Yeah, thanks. All right, I think I'm gonna hand it back to you at this point, Brad.
Okay, thanks, Jody. And just note that there's another question in the chat that maybe if you want to respond to in the chat, that would be great.
Yep, will do.
Okay, I also want to remind everyone that we will be sending an email this week, by the end of this week, that which is tomorrow, about the submission that's due from every consortium, and that submission is due August 3rd. Like every year, we have an August submission. This is required for every entity that was a consortium, or for every consortium that existed in the 2019-2020 year. The submission will be 4 parts, and they can all be emailed to Sherry Eichinger. The 4 parts are level gains with post-test report for July 2019 to June 2020. That needs to be an Excel spreadsheet. 2, we need your NRS primary goals report, again, that same time period, and again, as an Excel spreadsheet. We need, this is new for this year, we need an estimate of your workforce training costs for July 2019 to June 2020 for any IET programming that you had, that you used federal ABE funds to pay for the workforce training component of an IET. And that amount will be in the email, should be in your email body. And then also we want, once this is available, we want verification that you've checked your consortium state ABE aid calculation for fiscal year 2021, and that the number of contact hours and other data in that initial aid calc are correct. And the statement should be in the email body as well. Look for more details in the email that will go out to consortium managers today or tomorrow. So the key component that we want to make sure we talk about today is fall ABE programming. So you might have seen that we have some new guidance from the Minnesota Department of Education and Minnesota Department of Health on fall programming. And we do have those guidance documents attached. If you look in the materials, the 2 documents are the 06.18.20 MDE 2020-21 school year planning guidance. The second document for this guidance is labeled as MDH Guidance K-12 Planning Guide, or Plan Guide. So make sure you download those 2, and this is what the 2 materials look like. In addition, you might want to go to the Minnesota Department of Education's COVID-19 website because they have additional information that you may want to reference there. But the 2 documents, we're going to break those down today during our discussion. Overall, those 2 documents outline 3 potential delivery scenarios for fall: in-person, hybrid, or distance education only. And then the Minnesota Department of Education, along with the Minnesota Department of Health, will provide some guidance in terms of what options or scenarios are recommended or required during the week of July 27th. For example, if COVID-19 is hitting Minnesota hard, they might recommend everything is distance or require everything is distance only. So look for additional guidance on the week of July 27th on which of these scenarios is available to you in the fall. Please note, though, that programs may need or want to switch delivery models during the year, or maybe you'll need to implement multiple delivery models simultaneously for different groups, different classes, or different students. So each of these is important for you to explore and develop a plan. And let's walk through each of the 3 scenarios right now. First is in-person learning. This means that in-person learning could be available for all students. In this scenario, schools should create as much space as possible between students and between teachers as is feasible. But in this scenario, there would not be a required 6 feet of social distancing maintenance. This scenario would likely be implemented assuming that COVID-19 metrics continue to stabilize or improve. However, it's important to know that Minnesota Department of Health guidance and requirements still apply under this scenario. We're not going to spend too much more time talking about the in-person component because I think many of you do understand in-person programming. Instead, we're going to start with scenario 2, and I'm going to turn it over to Jody.
All right, thanks, Brad. I did just want to add on to the scenario 1 guidance, though. If you read the guidance, especially from the Minnesota Department of Health, it is clear that scenario 1 is not exactly a return to normal. It is not just a go back to how you were doing things pre-COVID. There's still, so keep that in mind. Yes, we definitely know how to do in-person programming, and that will be straightforward, but there will continue to be some health considerations and safety considerations for sure. Thank you, Brad. So moving on to scenario 2. Scenario 2 is hybrid. This is similar to what we have been approved to do this summer. And I know sounds like a few, maybe not a lot, but some ABE programs are choosing to try this hybrid option this summer. So hybrid means a combination of distance learning and in-person learning. A key factor of this scenario, if this is the approved scenario for the fall, this would mean a requirement to maintain 6 feet between people in the building, and with a maximum of 50% occupancy in the space. So essentially that means the smaller the space, the fewer the people that can be together in that space. Remember, hybrid means that students can access and participate in both in-person programming and distance learning, and hopefully those should integrate with each other and complement each other. And what the guidance says is that this scenario may be implemented or may be selected as the scenario that we are required to follow if the COVID-19 metrics get worse at any level. It's also possible, according to the guidance, that this could be implemented even if there is a scenario 1 situation of in-person programming is okay. Scenario 2 could still be required in particular places or communities if there is a cluster of cases. We do not have details about how that will be determined or communicated, but that is what the guidance said. On the next slide, we wanted to think a little bit about or continue thinking about what hybrid ABE programming may look like in an ABE setting. We want to recognize that this guidance, particularly the guidance from MDE, has a very K-12 kind of a focus. And in a K-12 setting, I think it's pretty easy and straightforward to imagine how one particular student might be accessing part of their instruction at home and part in the building. You know, maybe they go to the building every other day or something. We believe that in an ABE context, there's probably room for more variety and more flexibility around how that actually plays out. And so when thinking about that, here are some ideas and thoughts that we've had that we want to put out to you. And that is that we might consider in an ABE context that hybrid could mean that some students attend in person in addition to doing distance education, others continue as distance only. And that particularly that might be a way to improve programming for students who have difficulty accessing in the distance only model. We also think there is room to think strategically about what kinds of instruction or what kinds of activities happen in person as opposed to which happen using distance education. So it might be that that in-person component is really in support of the distance education. It might be students coming to the building to turn in, pick up work, get feedback on work perhaps. It might be that they're coming in for tech support or things like that. So we really encourage you to think strategically in our context of ABE about what hybrid means and what it could look like. And you won't find those details specifically within the MDE guidance, but so these are some sort of additional questions and things for you to be thinking about hybrid programming. So then in the three scenarios, the third scenario is distance learning only. And this is what we did in the spring. So I think we all know how that goes, and including the challenges of that scenario. But it is possible that we could be back in that scenario starting this fall. And we understand that that would happen if the COVID-19 metrics get worse, it's significantly worse. So if the number of cases start to go up or the number of hospitalizations start to go up and hospitals are reaching capacity, then this may be a scenario. In addition, we want to make sure that you recognize and realize that you as an ABE provider are asked to provide distance learning as an option for students who are medically vulnerable, for those who are high risk, for those who have pre-existing medical conditions, or are otherwise unable or unwilling to come back in person. So I think an important message here is distance learning is going to be a part of how we do this work moving forward. I know that's not news to you, but just reinforcing that even if we get the green light to do in-person or hybrid in the fall, we will all need to be considering how to continue a distance learning only option for particular students. And then as we are thinking about the three scenarios, we want you to suggest an equity lens that you could use on that. We know it's been challenging. It's going to continue to be challenging, and we know that we are faced with sort of impossible tasks and then almost impossible situations. We're all doing the very best we can given that. So just given that background, I acknowledge that first of all. We want you to be thinking about, depending on what ends up being allowable, you're going to be making some decisions about your programming. So we'd like to suggest some questions I know you're already thinking about. So I just want to reiterate, thinking about the students who have the most barriers and who are the hardest to serve in this time. So thinking about students who don't have dependable access to devices and the internet, students who don't have strong digital literacy skills, our beginning literacy students and beginning English students. And in addition to those groups, any students who may also fall into those categories, but any students who are vulnerable or at high risk of severe illness if they contract COVID-19. So we don't have answers to that question of how do we best serve these students. We wish we did have answers, and we know you are all considering those questions, and we just want to encourage you to continue considering those questions and continue to use that as the focus for the decisions that you are making. Another question that we think is worth asking at this point is, how have our student demographics changed since the COVID-related closures, and what are the implications of that? And once again, we don't know the answer to that question, but we encourage you maybe at this point to start looking back at your data if you have time and capacity to do that, and start thinking about that question, like who is doing okay and who's struggling, and what does that mean for us for thinking about the fall. So those are questions we encourage you to be considering. And you may also want to look at the MDE guidance, which does have some really solid sections on equity and equity consideration, and also an important section on tribal considerations. And we do encourage those of you who are working with tribal nations specifically, or serving individuals who are members of tribal nations and who are Native, we recommend that you take a look at that part as well. All right, I think I am going to pass it back to you at this point, Brad.
Excellent. Thank you, Jody. So within that MDE guidance, Jody highlighted a couple key sections there about equity and tribal considerations. There is also a section in the MDE guidance that is specific to adult basic education, starting on page 82. And you'll notice that this, the guidance on adult basic education really just outlines a little bit of who we are and stresses that the same three options or scenarios would apply to us as it applies to K-12. And so there's nothing unique in this part of the guidance per se, but we want to make sure you're aware of it, that they stress that what Department of Health recommends for K-12, they're recommending that for ABE as well, or the requirements for K-12 apply as well to ABE as well. And noting that that the guidance also stresses program delivery in an equitable way to ABE students and the communities that you serve. There is a separate section as well about testing on page 83 for adult basic education. And so it acknowledges many of our statements that we have made in the past, and all of our statements that we have made about testing exemptions and about remote testing still apply. Those same testing expectations have still been modified, and now we're acknowledging that exists, both the exemption for entering 12 or 4 hours for a student and the computer-based remote testing options. And then if Minnesota Department of Health and the Department of Education determine that in-person methods for intake and testing are safe for ABE programs or ABE students, we still encourage programs to prioritize collecting information for instructional and placement purposes and other key needs like that, instead of testing solely for accountability purposes, such as just for MSG's sake or just for increasing your post-testing rates. The goal of the in-person time and programming should be to allow for more equitable delivery of ABE programming. And we've acknowledged, as Chelsea has asked before, that our targets might exist yet for measurable skill gain, but the federal government has already put a waiver in saying, we acknowledge that you will not likely meet your targets. And so you should stress on offering and delivering programming, even though you might not be able to test students. So that we've already been given that leeway with the federal government. The Department of Education guidance also has some other key sections that you may want to reference that we will not go into further today. And so some of these sections are laid out here, including some additional health expectations, discussing district and school inventories, communications with students, families, and staff, how to engage students and families, internet and device access, tribal considerations, COVID-19 preparedness plan, especially with worker protections, and information about public libraries and their importance as a resource for our schools and our students. So that is the Minnesota summary of the Minnesota Department of Education guidance. I'm going to turn it over to Jody to help outline some of the Department of Health guidance.
All right, I do want to acknowledge we're seeing questions and discussion in the chat, and we are going to keep going, but we have soon we're going to get to a spot where we can pause and consider some of the questions that are coming up in the chat. So thank you for engaging in that way. But before we do that, before we address those questions, we do want to talk a little bit about this Minnesota Department of Health guidance. I will say this document, the Department of Health document, is a somewhat more approachable document than the MDE guidance. The MDE guidance is about 100 pages long, and probably for many of us, there are a lot of sections there that don't really apply, maybe like about school buses and school meals and special ed. So just know that. This MDH guidance is shorter. I think it's 16 pages, and I do encourage you, if you're a program manager or a coordinator or have any leadership responsibilities, and maybe all of us, to sort of read it word for word all the way through. And I think in general, while this guidance, it very much has a K-12 focus, it feels like it was written for elementary, middle, and high schools for sure. But I think from a general perspective, we should assume that these requirements and recommendations apply to ABE programs as well, as much as is reasonably possible. So in terms of the MDH guidance, these on this slide, there's a list of some of the key sections. We don't have time to talk through all of it today, but we are going to talk through a few that we think are particularly relevant for us in ABE. So the first one that we want to highlight is about cloth face coverings and face shields. So we think this is a topic we're all talking a lot about in our lives in general right now. So this guidance makes a strong recommendation about cloth face coverings and or non-medical face shields. The guidance asks us to teach and reinforce the use of face coverings. And it points out that face coverings are the most important in scenario 1, where we aren't necessarily maintaining 6 feet of distance between each other. So this is yet another way that scenario 1 is not a return to pre-COVID instruction. It is different. Even in scenario 1, there is a strong recommendation that anybody who is physically in your building is covering their face. And we are also encouraged to have a supply of face masks or face shields available for staff and students. We recognize the challenges of that, but that is being encouraged in this guidance. So I will just note, this particular aspect is not a requirement, but it is a strong recommendation. The next aspect of this guidance is about protecting vulnerable populations. So we have already touched on this. And I do want to point out, this is a requirement of this guidance. The requirement is to create a process for students and staff to self-identify as high risk for illness due to COVID-19. Now, there's no additional guidance about what that process needs to look like. And so you have some flexibility to figure out, practically speaking, what does that look like? But the important requirement is you need to allow both students and staff to self-identify as high risk. For staff, what that means, if staff self-identify, you need to have a plan in place to address any requests for an alternate work reassignment. So we're assuming that would mean a work from home type scenario. For students, you need to be prepared to offer distance learning to those who identify as high risk or those who are otherwise unwilling to return to in-person or hybrid learning. So what we're giving you here is what the guidance says. I already see that in the chat, there's already some questions about what does that mean? So we'll try to get to some of that in a little bit, but just know we don't necessarily have all those answers, but this is what the guidance says to start with. And then at this point, I'm gonna hand it back to Brad, right, Brad?
Yep. And the next chunk with the MDH guidance is about cleaning and materials handling. So it is a requirement that local programs establish a schedule for routine cleaning and disinfection of high-touch surfaces and shared equipment throughout the day. For example, this summer, this already started with GED test centers with their counters and computers. We also want to, the requirement is to ensure that adequate supplies are available to minimize sharing of high-touch materials to the extent that is possible. So less resource sharing or textbook sharing as much as possible. The next section with Minnesota Department of Health guidance is about monitoring and excluding for illness. So the requirement is that staff and students stay home if they have tested positive for or are showing COVID-19 symptoms, or if they have recently had close contact with a person with COVID-19. It is also a requirement that programs conduct symptom screening for any person entering the school building. This includes communicating expectations and the processes for screening with students, staff, and other visitors. This also includes establishing action steps for students or staff who arrive ill and do not pass screening. Programs are required as well to develop a contingency plan to cover staff sick leave, which includes potentially appropriate cross-training of staff to cover. So this is a big expectation. And so we wanted to take some time to really discuss this a little bit more in depth about screening. So yes, the expectation is to screen everyone entering the building. And so strategies for screening students, staff, volunteers, and other visitors, you'll see with this link, and this is attached as well as a document, is there's a set of screener questions you can use to check for symptoms. And so I encourage you to look for that, resource here in your materials section. That is called the, I'm sorry, I'm having a lot of trouble with the materials tab right now, and it's not working for me. But there is a resource in the materials tab that includes this screener. In addition, it requires temperature checks. Either people take their own temperature before reporting to the building, or a staff person takes every person's temperature as they enter the building. So let's open it up for some discussion specifically right now about screening people that enter the building. I'd like to hear in the chat, how might some of you implement this? Have some of you already been doing this with GED testing and or as you start summer programming in a hybrid version? Yes, Caroline, I am saying that the MDH guidance says that temp screening is required either in person as they arrive, or if the person takes their temperature before they arrive. So let's open it up. Astrid, I'm going to have you maybe help me with some of the questions specific to screening. If you would like to ask your question verbally, I also encourage you to click to raise your hand, and we will unmute you so you can ask your question verbally.
Okay, and just to clarify right now, we're just taking questions about screening. I've been noting all of the other questions that have been coming in, and we will have a slide to where we'll address those. Caroline is asking a follow-up question about how we verify if people have taken their temperature before they arrive. Any information about that, Brad?
My interpretation of the guidance is that it is self-report. So if the person said that they took their temperature before they arrived and they they did not have an above average temperature, then that is self-report is fine.
Okay. Looks like some comments. Go ahead.
Can I add a little bit more to that? So I think we are getting into a little bit of, interpreting what's in the guidance a little bit. So I think I actually interpreted a little different than you did, Brad, and I think maybe we should just admit that we're all kind of trying to figure out what this means. My interpretation was that screening is required and that temperature screening is one way to do screening, but that another possible way to do screening is using basically a questionnaire. And one of the questions would probably be, do you have a fever? Or a question could be, did you take your temperature this morning and what was it? So I think it's not quite so restrictive that everybody has to have their temperature taken, but the requirement is that everybody is screened. And of course, having a fever is one of the most important, red flags for COVID-19. So that's my understanding of that.
And because there are different interpretations of this, you might need to reach out to your district or host organization to help you interpret how your organization is going to interpret this guidance. Exactly,
yes.
It's really important. So we're seeing some comments in the chat from programs that are already implementing some type of screening. Anesia says they're taking temps of all staff and students at the door and then asking people to wash or sanitize hands. Penny says for the GED testing, they have a screening sheet that people are looking over. Sherry says they meet students at the door and take temperature and ask screening questions. Allison's expressing concern about the fact that people may be contagious prior to showing any symptoms. Yep, so it looks like for a lot of programs, a common practice is a temperature check and a form or a screener at the door. And that is where people are also checking for masks.
I also see that Emily Watts was wondering if anyone has any screener questions or screener sheets in multiple languages for some of the English language learners they might be serving. Great question, Emily. And if anyone does have that information, please share it in the chat. I would also encourage, I know the Minnesota Department of Health has been putting different guidance in different languages as in some other languages as well. So you may want to check the Minnesota Department of Health website too.
Yep, so as we mentioned earlier, we will post the chat log for this webinar because so many great ideas are being shared. And then just encourage people again to go to our Schoology site. That would be a place to check in with other folks in the field to see what they have put in place. So I am not seeing additional questions regarding screening coming in.
Excellent. Well, I might have us move along then, and then we'll still have time for additional questions later on. But we do have an additional question for you to consider. For all of you that have ABE programming in a partner location, say at a post-secondary institution, career force center, another nonprofit organization, or a correctional institution, there may be different requirements that apply. And we want you also to think about how you'd apply screening in those situations or those spaces, especially if the partner needs or wants to screen the same way as the ABE program. You could collaborate as people enter the building. However, if the partner is not going to be doing screening as people enter the building, you may need to do screening when people enter the ABE space. So those are a couple ways that you could approach this locally, depending on what your partner agency is doing. We're going to keep going here, and I'm going to turn it over to Jody to talk about mental health.
All right, so just a couple more things to highlight in the MDH guidance. There is a requirement in that guidance that our programs provide staff and students with information on how to access resources for mental health and wellness. And we just wanted to highlight this because it seems, the longer we are in this situation, the more we are recognizing that in addition to the physical health issues and the public health concerns, there are very real mental health issues at play here. We don't see this as a sort of mandate to create a flyer or send out an email per se, although you might consider those strategies, but really consider this as making sure that your ABE staff is prepared to refer students to appropriate needs when they have, or to appropriate resources when they have mental health and wellness needs. So we just wanted to highlight that, and there's some additional information in the MDE guidance about this as well that you may want to consider. So just something to be really keeping in mind for the future. And then we just want to kind of summarize what all we've been talking about, and remember what the situation we're in now is. We are all being asked to prepare for each of these three scenarios. We are not sure which scenario we will be in come fall, but we do know that it's possible, even if we start with one scenario, we could switch to a different scenario, or even if we have one scenario statewide, particular communities might need to do something more restrictive. So really the message is be thinking about all three of these possible scenarios and be planning, as I know most of you already are. And then I think that we are at the point to take some questions. Is there anything else, Brad?
No, I think we're ready to answer some key relevant questions that have been raised, but we are also acknowledging that our time is also running short too. So Astrid, any key questions that we have not yet answered?
Yes, so we'll circle back. You did mention, Brad, earlier, there was a question about our targets for measurable skill gain and how those might be impacted by closures. And just a reminder that Brad did mention that at the federal level, they will be waiving some of the consequences for not meeting those targets. So we're also considering how to implement that locally. So I think you can rest at ease around that. Also, a number of questions regarding staffing. So some follow-up questions about staff maybe who have family in a high-risk category, questions about whether programs are required to have an alternate assignment for staff who are not comfortable teaching in person. So Brad or Jody, do you want to chime in with any additional information about that?
Yeah, so I think we are in the situation right now where the guidance that we have is the guidance that we have, and we, as the MDE ABE team, do not have any additional information around specific requirements other than what's in the guidance. So we are at the point of that we take what's in the guidance and interpret it as best we can. I guess I will start with my interpretation of what I believe the guidance to mean, and I'm open to others on our team possibly having slightly different interpretations, but I believe it's clear that ABE programs are required to allow staff to identify as high risk, and that they are required to consider a request for an alternate work assignment for that individual. That to me seems clear that that's required. What is required after that is not specified. To me, it makes very much sense that that individual who has self-identified as high risk is given a work assignment where they do not have to report physically to the building. And to me, it also makes a lot of sense that if a staff member has an immediate family member who shares their same household who is high risk, that consideration would also be extended to in that scenario. However, unless I am wrong, and I might need to go back and check for sure, I don't believe that the guidance specifically addresses that situation. Anybody want to add more to that?
Yeah, I would say for this question in particular, I think it will be really important to stay in touch with your district leadership and union leadership to make sure that you're tapping into whatever guidance and policies and procedures they're putting in place.
Exactly. Yes, agreed.
We also had another question about what programs' responsibility might be around alerting students and staff when they become aware of a positive COVID case. Again, I think that will be a really important thing to discuss with your district. Jody and Brad, any additional thoughts you have based on the guidance that is currently available?
So the guidance is clear that if someone is showing symptoms that they are to either not report to the building at all or to leave the building to go home, correct, Jody?
Correct. I think what is clear is the requirement is, yep, you need to make sure people who have symptoms don't come in the building, or if they do get in the building, they need to, leave safely if they have symptoms. I do not believe we have any responsibility around informing other individuals, and I think that's actually that's what public health officials do when they do contact tracing. So I believe it's true that anyone in Minnesota who takes a COVID-19 test and gets a positive result, hopefully whatever public health entity is responsible for that testing center is initiating a process of contact tracing. And so I think it is likely if one of your students is diagnosed officially with COVID-19, there may be some contact tracing that happens that lets other students know. But I do not believe that we as ABE providers are responsible to do that work.
Okay, thank you, Jody. Then we had another question about whether programs could require masks. The guidance strongly recommends it. Could they require it?
Mm-hmm.
I think, Brad, you chimed in the chat that yes, an organization could choose to place additional requirements that are more stringent than the guidance. And another question about whether any programs have developed a template for self-reporting or if any programs have created a letter already to send to students covering expectations for returning to in-person programming. So I would just ask folks if you have any of those things, if you wouldn't mind putting that in the chat. Another request for the list of the members of the contact hour working group, and Brad has put that in the chat, and Susan Wettenkamp-Brandt has said people can feel free to contact her with questions or input that she can share with that group.
And I would also add, Astrid, that Caroline asked a good notice as well. Just as Jody was noting that we have to be a little hesitant about how much interpretation we do with the guidance. Even you at the local level might need to be cautious about how if you're developing your own resources or interpreting developing your own interpretation of policy, that could be problematic as well. So we want to make sure you're working with your host organization or your employer as you do this planning to make sure that you are supported by your organization.
Yeah, thanks, Brad. And then a follow-up question from Teresa regarding staff request for reassignment if they are not able to return to in-person programming, whether programs have to consider the request but not necessarily have to provide an alternate assignment. I'm not sure that we have that level of detail at this point.
Right, and I think, Teresa, you will have to work with your district to decide how that's being interpreted locally.
Yep.
So I believe I've captured all of the main questions. If we have missed your question or you still have a question that has not been answered, I just ask that you please put that back in the chat to bump it down to the bottom.
We do also want to know a little bit about how you're planning for fall, just some initial thoughts. We may not have time to dive too deep into this right now. We are running short on time, but we want you to think about how you could start planning this with your K-12 colleagues as well, and how you might be collaborating with them in this process. And Jody, do you want to talk about next steps?
Yeah, sure. So we recognize, and as we're seeing right now, this is bringing up a lot of questions. And there really are, a lot of legitimate and important questions, and not nearly as many answers as we would like. So we are wondering if there would be interest in scheduling another webinar sometime in the upcoming weeks, where we could reconvene and talk more together. Maybe it would be particular interest to, folks who are in management positions or coordinators that are, making staffing decisions and things like that. And maybe have it be a little more open where you all can sort of share ideas and thoughts with each other. So we are curious to know whether there is interest in doing something like that. And if so, we will figure out a time on the calendar. So probably, I think sometime in July. Looks like there's some enthusiasm for that. So be watching for something. Oh, I see your comment, Renata. So we just want to acknowledge that MDE will be announcing, what is the approved scenario sometime after July 27th. We are already planning that we'll need to convene everybody again after that announcement comes out. So we're really thinking about something in the meantime that would be less sort of presentation and more just idea sharing and gathering. All right, thanks everybody.
Excellent. Thanks, Jody. For the sake of time, we are going to talk now about some of our other topics as well, but we will have some time for questions at the end of the session. We have some updates in terms of testing. First, we just want to remind folks that the COVID-19 testing estimate, this is a change from the original COVID EFL exemption that we had. So the new change is that instead of just one generic COVID EFL exemption, we have now need to turn it into a COVID ABE EFL estimate and a COVID ESL EFL estimate. And the reason for that is the federal government needs us to determine for all of the students that are going through intake and starting now that do not have a pretest, they're requiring that local programs set a provisional level and based on your own informal assessment or teacher judgment. And so that COVID ABE EFL estimate is for students that would be in an ABE level according to your estimate, and the ESL EFL estimate would be for those that you think would be at an ESL level. And then you would just guess your set a provisional level by entering a score of 1 to 6 for that. Those provisional levels just would help determine where they are in testing. If the student receives an official pretest later and gets a different score, you do not get a level gain or measurable skill gain out of that, but it would just reset to a new official level at that point. So this is just for identifying provisional level. If you have questions about that, I strongly encourage you to either read the SID help article on COVID ESL ABE EFL estimates or email SID support. We also wanted to let you know that we are going to we had some excess supplemental service funding, and so we are going to be purchasing computer-based tests and distributing them to ABE consortia. We have roughly $62,000 that we can use that will split evenly between CASAS and TABE. We'll be purchasing CASAS Goals and Life and Work Enhanced e-tests, as well as TABE Online 11 and 12. This would be available to any ABE consortium that receives the required training and has a CASAS e-testing account set up or gets one set up, or a TABE Online account set up. So some details about this. During the next 2 months, either in July or August, we'll be announcing some training on computer-based testing. And in August, September, we will be distributing the first round of tests to programs after the training. And in terms of what that distribution will look like across consortium, we first need to know which consortia will be eligible and what consortia want. So we won't be able to announce how our plans for how we'll distribute those test vouchers for another month or for another couple of months. Some of the trainings that we're going to be providing. These will be trainings that are kind of co-developed between our office, our state ABE trainers at Southwest Minnesota, like Marty Olson and Linda Keller, as well as the test publisher. We'll have some just general test overview trainings, some topics about administering computer-based testing, as well as remote testing requirements. For any of you that were not part of our remote testing basics webinar, there's a link right here. You can find it at mnabe.org under state ABE presentations. That's everything regarding testing, but let's talk a little bit about high school equivalency. So in the chat, we do want a poll right now. We'd like to hear from you. So please enter in the chat, which GED test centers are open in your communities and offering testing? Which GED testing centers are currently closed? We do not have an official list from GED Testing Service, so we are wanting to know from you which test centers are open and which ones are closed. In addition, if you do have test centers that are closed, is there any scheduled date for that session or for that testing center to open? And we'd like to know that as well. So please continue to enter test centers which are open and which are closed in the chat. And we are going to compile this list at the end of the webinar as well and keep this on hand. Some folks are curious about how GED numbers are looking. GED numbers, we had only 244 tests in May, but in June, as of June 22nd, we had 381 tests. 317 people have tested in May and June, and we've had actually 126 testers who have graduated with a GED diploma. One other aspect of testing that is making testing more available for some is what's called OP testing. We have talked about OP testing before, and OP stands for GED Online Proctored Testing. This means that a tester could take the GED test from a location that is not an official testing center. This could be most likely at home, but in cases where there might not be a GED test center open, it could also be an ABE program that is able to host create a space for someone. The test is officially proctored via online video by someone from OnView, which is a corporation, a subsidiary of Pearson VUE. This is currently in its pilot phase, and Minnesota is participating. Some OP updates. In order to be able to participate in the pilot, a tester does need to have a GED ready, quote unquote, green score, meaning they're likely to pass within the last 60 days of scheduling that OP test. And testers need to read their emails carefully about how to sign up for OP testing. And if they have questions, the first place they should look is the website. And any educators, I want you to know that there was a small glitch in the GED testing system for OP scheduling. And if you know of any students that hit that glitch where they should have been eligible, but they weren't able to schedule the test due to that glitch, please email Melissa Hultstrand. Her email is on a future slide if you do not have that. And she will reach out to VUE to help remove any of those glitches. This pilot phase will end August 1st. After August 1st, they're planning to make OP available to more students or to basically anyone that could be eligible. Some statistics about OP. Specifically, we've had 281 people test or credentialed nationally, only 2 so far in Minnesota. Nationally, OP tests are averaging more than 100 a day. In fact, there were close to 200 just the other day. We've had more than 1,118 OP tests passed nationally, and 18 people have taken 30 OP tests here in Minnesota alone over the last couple of weeks. There are some technical details that you really want to make sure that are clear with students before you push them into OP. The number one thing is, do they have the appropriate technology that meets the GED system requirements? And do they have dependable internet in order to take that? So that is the key number one requirement. And there is a systems check that someone can do when they schedule OP testing. And it's strongly encouraged that testers try that out immediately. Testers can check in as much as 30 minutes before and as late as 15 minutes after their scheduled test start time. And they can cancel their testing up to 30 minutes before the scheduled test time for OP testing and not lose their funding, lose their payment. Testers, instead of the normal scratch pad or whiteboard that they can use, they have to use the on-screen scratch pad. And GED Testing Service will be putting more information about that on their website soon. During this pilot, testers must be 18 or older during the pilot. There is an issue with data privacy and having minors on online video screens that they were not able to work through that legal issue for the pilot period. The test cost is the same as on-site GED testing, and the OP test is currently only available in English. So I know we had some questions about how does a learner find out about the OP test option, and they will learn if they're available during this pilot period, they will receive an email and get notification in their GED.com account. So they should be checking there to see if they're eligible. If you provide testing vouchers, are you able to give those vouchers for an OP testing situation? Yes. You are able to use the MNGED 30 code for OP testing, as well as any local testing vouchers that you might have available. We also have been noting that there have been some issues with GED testing service support. There's been especially with OP testing piloting, there's been a longer than usual call wait time in the customer support line, and that's been frustrating for testers and educators. So GED Testing Service has asked that I promote some recommendations for you. First, make sure to check the website. They say that the vast majority of calls that are coming in can be found fairly easily on the GED.com website. So make sure that people are checking the website. In addition, if you do want to call though, the best times to call would be from 7 to 9 a.m. in the morning or 4 to 7 p.m. and that's all Central Daylight Time. And you can also always email questions to help@ged.com. And in fact, they've said some people have been getting responses and assistance more quickly via email than via calling during the middle of the day. And I have attached as well the GED support line information, and make sure that you're utilizing this. This was revised recently, so I want to make sure you have the most up-to-date version as we go forward. So make sure you get this in the materials section. And if you have any expiring vouchers, please email Melissa Hultstrand. Her email is at the bottom, and send her or include all the unused voucher codes that you might have as you try to, and then she can renew those vouchers. And there is a GED Ready promotion, 50% off for individuals. This is not available for programs to do bulk purchasing, only for an individual. And we did get a question about the MNGED 30 code. So Meg, the MNGED 30 code is being extended for tests between July 1 and September 30th. However, that will not be turned on until next week, and that is because staff at Minnesota Management and Budget are still revising or reviewing the contract, and they cannot sign the contract until next week. So the code for testing in July to September will not be activated or extended to this time period until next week. And the competition for high school equivalency assessments is being posted anytime. We're just finalizing the reviewer slate and we're getting confirmation of who our evaluators will be from tribal nation representatives or someone working with American Indian students. Thanks to those of you that have reached out to me to be evaluators for the high school equivalency assessment competition. We anticipate the results will be available August or September. Okay, I know we're running short on time here. I'm going to turn it over to Julie quick to talk through her sections. Julie.
Right, you can go to the next screen. Thank you, Brad. I wanted to mention that there is a program out where it's called Healthcare Heroes, and several healthcare facilities in the metro area and other areas have gotten together to try to streamline hiring people who would be interested in housekeeping, dietary, custodian, or nursing assistants. If you'd like to know more as an administrator about how to help students access this, please tune into a webinar this coming Monday at 9:30 a.m. You can register in advance for this. If you were running any CNA courses or any nurse housekeeping or dietary aid courses, please look at learners that maybe weren't able to get jobs in the past or are still interested in it, and they could be connected through this. Next screen, please. Just an update on the regional transitions plan. They were reviewed on Monday. And you'll receive feedback on those by June 30th. You cannot spend funding until it has been approved. And just an additional note that $5,000 has been added per region. Next slide, please. Thank you, Brad. As far as the integrated education and training approval forms, we received 38 of them, and we're in the process of reviewing them. We're hoping to notify those that we thought possibly did not qualify as IET by the end of June, so that those can be removed from the database. And then we're going to continue to further evaluate them just to determine what PD might be needed in the future. Next slide, please. And for those of you with integrated English literacy and civics education grants, the end of the year report will be due Friday, July 31st. Grantees will receive a template either tomorrow or early next week. You should have already received an official grant award notification for funding for next year that should begin July 1st. And just a reminder that you need to submit a budget for that upcoming year. I think that's it. Next slide. Oh, one more thing. The WIOA Memorandums of Understanding, I'm receiving a lot of questions about this. They are due July 1st, and there is an option for the board member, the Adult Basic Education Board representative to sign for all the ABE programs in the local workforce development area, or you can have each consortium sign off on the MOU. But just so you know, that needs to be communicated to the board chair. Next slide, please.
Julian, that's everything from the transition section. Thank you all. Thank you very much. I'm going to turn it over to Astrid to share some distance learning.
Okay, great. Thanks, Brad. We can go to the next slide. We just wanted to make sure that everyone saw the email that went out yesterday. We're very excited that through your annual SID and distance learning education contract with Literacy Minnesota, we now will have 2 new state-supported distance learning platforms available July 1st. Folks hopefully remember that the decision was made to discontinue our statewide license for Burlington English because of more limited use and feedback from programs. And that has allowed us to purchase a statewide license for both MobyMax and EdReady. We're really excited. When we surveyed programs back in the fall, we definitely heard a lot of requests for MobyMax, and this helps to fill the gap for a program appropriate for English language learners. And then EdReady can complement some of your math and English readiness, GED prep, and college readiness needs. So more information about how you will access those, training and support will be coming soon from the distance learning team. That we just finalized these decisions recently, so they're working hard to work out the details. We've also gotten a couple questions from programs that may have already purchased licenses for the administrative version of MobyMax, and there will be an option for you to be refunded at a prorated rate for what you've already used for that platform. But Susan Wettenkamp-Brandt will be sending out some additional details about that in the next couple of weeks. So stay tuned. Let's go to the next slide. And we also just wanted to remind folks that we now have an option for you to apply to have your teacher created courses approved for counting distance learning proxy hours. And wanted to clarify that this process is really designed to be used for courses that have at least 12 online lessons, have a set cohort of students, a set of course objectives, and a clear plan for how students will move through that material. So you can follow the link here to get some more information about that. If you go to the next slide, Brad, this teacher created course approval process is not designed to be used for your ongoing instruction. So just for rolling enrollment of your ELL or GED lab classes, we are in the process working with the distance learning team to explore what a process for awarding proxy hours for teacher verified distance learning materials that do not fit that course definition, what that could look like. And that would likely involve some training for all those involved to be able to count proxy hours. This is just in the beginning stages, so we'll be continuing to work on this throughout the rest of the summer, and hopefully within the next couple of months we'll have some more information for you for what this might look like. And so we are just about at the end of time. Brad, let's go ahead very quickly just through a couple of the PD slides, and then I would invite you to download the slides to get some additional details after the webinar. Just a reminder that our COVID-19 Schoology group is out there for you to connect with each other and our support network. Go to the next slide. A couple of virtual coffee breaks scheduled for the summer, one tomorrow about anti-racism work in ABE, and then we'll be having a midsummer ABE check-in around a variety of instructional areas in July. Let's go to the next slide. A new webinar has just been scheduled. We'll be partnering with Cynthia Peters from World Education and the National Coalition of Literacy to provide training for you all to work with your students to train them to become census ambassadors. So to work with folks in their community to educate them about the importance of the census and ask them to make the pledge to participate in the census. So we've got some information here, and that will be on the Atlas PD calendar, so you can get registered for that. Just a reminder that all of our webinars are archived on our PD YouTube channel. Go to the next slide. Summer Institute, if you haven't heard, is going virtual this year. Registration is now open as of this week, and it's a deal. It's only $49 for LAN members. So hopefully that will mean that many people will be able to participate. Maybe if you've had staff in the past who've not been able to travel, they'll be able to engage in that conference this year. So thank you very much to the LAN committee for making a quick turn to be able to deliver this in a virtual format. Next slide. And just wanted to let everyone know that we at our state ABE office and with all of our support network providers have made the decision that all of our professional development, at least through the end of December, will be virtual. So you've got a list of some of the events that are going to be held this fall in a virtual format. We're still considering what regionals may look like this year, since they won't need to be regional, they'll be virtual. So please mark your calendar for these events. And you also received an email yesterday to managers and coordinators to please provide some input about what training needs you might have for new staff. We're not going to be able to offer the in-person ABE foundations that we typically offer at Summer Institute and Support Services Conference. So if you are even possibly planning to bring on any new staff this year, please take a few minutes, just 2 or 3 minutes to complete the survey and let us know what your needs are so that the team at Atlas can determine the best way to deliver that training. And I think this is our final reminder. Just wanted to let people know, we did have an email that went out about this as well via our ABE Connect, that we are looking for a couple of folks to join our statewide PD committee. That's a 2-year term. We'll be meeting virtually, at least for the first part of this year. And in this year in particular, we'd love to have some folks with some experience with distance education and or virtual professional development, as that's going to be our primary delivery model in the coming year. So that application is available in the materials tab. Okay, Brad, we can go ahead and wrap up here. I'm going to thank everyone for joining us.
It was a whirlwind, especially towards the end there. Thank you very much, Esther, for going through that fairly quickly. I want to thank everybody for participating today, and we can end the recording now. Resources can be found